Hello and welcome to this special web series of ours which is called Be Safe, Be Insured with Bajaj Allianz General Insurance, India's leading general insurance company. And joining me today is a special guest, the doyen, you can call him, of the general insurance sector in India. Lots to chat with him about today, Tapan Singhel. Thanks very much, Tapan, for coming by to the Money Mile studio and talking to us. I know you've come from Pune and it's always wonderful talking to you. But let's, over the next half an hour, try and spend some time understanding what's going on in the world of insurance. So I'm going to divide this into many different parts of insurance. But the first up question, which probably concerns a lot of people, is health. Are you seeing a lot of change in the manner in which people are looking at health insurance, though the penetration still remains low, but are you seeing a change in attitude?
First and foremost, it's a pleasure, as usual, talking to you, and thank you for the invitation. Now, if I look at health insurance, I have a strong belief that the penetration of health insurance should go up for a country to do good. You know what? If you look at people who have a health cover and who don't have a health cover, the difference is about 10 years of your life. So it's like if I make a statement that if you have a health cover, you will live 10 years more than when you don't have. Now that looks like a very absurd statement to say that 10 years of life will be more if you have health cover. But let's analyze why. Let's look at countries where they don't have adequate health cover or infrastructure. Let's take Uganda. If you look at the average life expectancy of that country is about 42 years, if I'm not wrong. And look at some countries like where you have excessively good health care. Let's look at Japan or Casablanca. You'll have something like 90 plus. Why is it so? Let's look at a customer who doesn't have health cover and let's look at one who has. Now, one who does not have a health cover, if he has some kind of illness building up, his biggest doctor is the pharmacist next door. He'll go and say, okay, this is what's happening, what do you suggest? And the pharmacist says, okay, have this. No, that's it. So first he tries to heal himself or herself using the pharmacist's advice. Then when it goes wrong and it gets a bit more serious, then he or she starts thinking, this may cost a lot of money. So I go to the neighborhood clinic or doctor, which may cost me a bit less, and it should be fine because I have saved all my life for my daughter's wedding or for my son's education or trying to build a house. How can I just blow it up? So he goes there. In the entire process, because of not getting good advice or the best doctor or the best treatment, he's curtailing his or her life. And that is where when somebody is insured and they have an illness, they pick up the best hospital, the best surgeons, the best doctors, and their probability of living more goes up. So it's that serious. I think first I want to make this point that if you are not covered well, you are risking the number of years that you live.
So you're actually giving a fresh perspective here, that you look at it as a social issue.
Exactly.
If you're buying it, it's about your life.
Yes.
It's not just about getting some money when you fall sick.
Yes. And the second issue is, let us say you had a very healthy life and try and do this. Go to a hospital and watch. There's this old person who has become sick now and he has to be operated. And he or she have the children around. And now the doctor or the hospital says that requires so much money. Now the kids are trying to figure out who's going to pay. It's a fact, it's sad. And it is not like 100%, there will be exceptions, but majority of places have seen that. Now when you have grown old, would you want that to happen to you? You are lying and you see your kids, trying to figure out who will pay. Or would you like to lead a life of dignity where you have a good health cover and you just walk in, and walk out? Do that. Difference in the quality of life, difference in the number of years you live can be taken care of just by a simple thing like a health insurance. So I'm such a strong supporter that every individual should have a health cover. And that's why when the national health scheme was coming by the government, I was one of those early strong supporters. I think there may be some issues which will get sorted out, but let's support this. It's going to make a difference to the life expectancy of the citizen of India. Let's all heartedly support this. Let's see how do we make it work. For the simple reason, it has such a huge impact. To me, health insurance is that powerful.